Vital tooth whitening. In this video I am trying to cover some backgrounds on the tooth discolorations, at the same time present some old cases and one new tooth whitening case. The first thing I look at when the patient's coming to see me is what is aesthetic on their eyes, whether just a whitening can do the procedure or they need some more treatment. As we know, there are many reasons for discolorations and there are hundreds of products in the market that different practitioners are using. Whatever product that we use, it's very important to remember what is the reason for the dental discoloration. Is the dental discoloration an intrinsic or extrinsic stain? What is where does the discoloration come from, so that we can find the right answer for it. Extrinsic stains like tobacco, coffee, tea, oral hygiene deficiency, drugs, or food of different kind can cause brown, black, green or orange, or combination of these discolorations. Sometimes a simple scaling polish and oral hygiene instruction can make patients happy, and for that we have to use different kind of products, as from normal scaling polish products or the other machineries that dental surgeries we can find. And this is an extrinsic stain. I just used just a scaling polish and the patient was very happy. So whether the systemic medication, dental trauma, endodontic material, restorative material, sometimes sub-products from illnesses causing the extrinsic stains, we have to find out these are pre-eruptive or post-eruptive when it goes to intrinsic stains. For instance, dentinogenesis imperfecta, melogenesis imperfecta are pre-eruptive, and also could be fluorisis and tetracycline as well. Treating them have got different approaches. For intrinsic stains like fluorisis, of course microdermabrasion is the best thing, microabrasion. But pre-eruptive like tetracycline, for instance, can be bleached, very difficult. Bleaching, of course, can take up to 5-6 months, but it is possible. In this case I just use microabrasion, and now I've got a few old pictures from tetracycline discolorations in past. Intrinsic discolorations could be trauma, aging, external internal desorption, and pulp calcification. Of course, these are all post-eruptives. Vital tooth whitening. The first thing I'm trying to establish when a patient's coming in for this kind of procedures, diagnosis, prognosis, and treatment planning. Diagnosis and prognosis, we have to evaluate the color to find the reason for it, whether what the condition of the tooth, and whether it's been whitened before, take photographs, and what is the endodontic condition of the tooth. When we do treatment planning, we have to see the possibility of improvement, the risks involved, longevity of the treatment we do, techniques that we're using, possibility of discomfort during or after treatment, pain, and of course consent form. The agents are using hydrogen peroxide, carbamide peroxide, and sodium perborate, or a combination of these at different concentrations. Techniques that I'm using is, of course, initial registration, the color choice, and then taking the color and taking the impressions. The cast is ready now, and preparing the machine, and make sure we have all the equipment ready, and we have acetate plates. We cut them if necessary, and put them on the cast and turn the machine on. When the heating is on, gradually start to melt down over the cast, and then we turn the vacuum on and leave it to cool down. Once it's cooled, we actually remove it from the cast and start to cut the edges nicely all around, just like that. There are different methods for finishing them, over the gingival margin or under. This depends on the procedure, on the dentist. Let's see, we teach the patient how to use, in this case, 10% carbamide peroxide whiteness dental. And before and after a week, patient coming back happily, in this case, of course. And to maintain it, white strips sometimes used from Crest Dental. Also, trays can be given to patient to continue the tooth whitening, even like once a week or once a month, until the whitening actually stays for a longer period of time and stabilizes. In office whitening, so we can do 35% hydrogen peroxide, 37% carbamide peroxide, or hydrogen peroxide and sodium perborate. So carbamide peroxide in this case is used 30 to 37%. The cost is more, shorter time to achieve the result, which is good. Sensitivity is usually happens, and the patients, ideal patients don't have too much time. The first thing we do, of course, like I mentioned in previous patient, is to take the shade, make the trays, and then apply the gel, in this case 35% carbamide peroxide, and fit the trays. Patient sits in the waiting room for an hour reading a newspaper, comes back, and here we go. We have teeth whitened nicely, usually not causing too much hassle on sensitivity. And if we're going to use hydrogen peroxide, then it has to be absolute isolation, so rubber dam, of course, gum protection, and then the time is very quick. The patient's sitting, but it takes more time for the dentist. Again, initial registration. Most of the time I do with the scaling polish if there is stains, to get rid of all the stains before the procedure, as you can see. And then the gingival protection gel, and after that the rubber dam, of course. Protection for my own hands are also very important. Here we go, the soft tissue protection with the gel at the top, and also coming with the rubber dam. So the whiteness is the material that I use, hydrogen peroxide. It's two different bottles. I mix them together. One of them is just the color, to make us see the clear gel, and will be applied on the teeth. It can be changed every 10 minutes, 15 minutes, sometimes 20. Different dentists have different time limits on their whitening procedures. And carbonate can be used for desensitizing the teeth also. At the end, I polish them and remove the rubber dam, and usually give the patient trays to take home for about 3 to 5 nights to use the bright night or night whitening procedures to stabilize the whitening. This patient is a new patient, actually consulted me for tooth whitening, was slightly unhappy about her smile, and as you see, laterals are missing, and someone's trying to put some composite to shadow the colors and the shape of the canines. Just one filling, upper left 6. Patient has very good oral hygiene and almost no cavities or no fillings available. Just one as C of left 6. So good candidate, no recession, no periodontal problems. So taking shade, that's registration phase between A2 and A3, mostly A3, and using Vita Shade Guide, impression taken, of course, as and trays made and given to patient to tooth whitening. Patient came back a week later. Now we have B1, but still unhappy about, of course, the canines, which are now laterals. So using techniques I learned in King's College, Gradia material was used to reshape the canines, and as you can see, they now look like laterals more than before. The patient was very happy about the result, and I called that a successful case. So there are a few things before, during and after the procedure that we have to pay attention to. It's the patient reason to coming to see us, the protection, cooperation of the patient, hygiene, expectations, and whether the patient is doing it very often. Cancer I had to mention here because it's written in many books, but Professor Brian Miller disagrees with that. That's why I had 2 question marks in front of that. Anyway, thank you for your attention. Good luck.